Welcome to the Rewilded Human Podcast, where Dr. Lucille, holistic psychiatrist and psychotherapist, and Dr. Lynn, naturopath and nutritional consultant, help you reconnect with your true self. Through practical tips on mental health, nutrition, exercise, relationships, and spirituality, with a dash of humor, they tackle today's toughest issues to guide you back to a harmonious, vibrant life. Rediscover your natural self, just as nature intended.
Hello, everyone, and welcome back to the Rewilded Human Podcast. We have a real treat for you guys today. You're going to love this episode. You're going to learn everything you need to know about dental and oral health and all the scams out there. We're going to talk about what kind of toothpaste you should use, why you need to avoid fluoride, dental implants, all the unnecessary extractions of wisdom teeth that are being done for money, for profits. Should you be using dental floss or maybe not? We'll talk about tooth whitening. We'll talk about red light therapy, how red light can actually benefit your teeth. So Kelly's all about holistic natural dentistry, and she's very, very knowledgeable in quantum biology and how the sun, how being in nature can actually even impact our teeth and our oral health. And this is such crucial information, guys. You don't want to miss this episode. So we're going to dive right in. I hope you enjoy every moment. Hello, everyone. Welcome back to the Rewilded Human Podcast. We have a very, very special guest for you today, and we're going to talk all about the horrors of modern day dentistry. Kelly, welcome. Welcome to the podcast.
Welcome.
Thank you.
Thank you.
You have a lot of experience, and we love listening to your episodes with other podcasters. And we have so many questions for you. And where do we start? What is like the most pressing thing that we need to talk about when it comes to dentistry? What's happening today?
I've been in dentistry for over 30 years. And at this point in my career, I really don't see anything good happening in dentistry. It's very much like medicine, that we're not making headway. There isn't the focus on prevention, and their only focus on prevention is by way of fluoride, which we understand now is not a good idea. So it's just, I find it to be very much a money grab. And more often than not, the more treatment that is recommended and the more treatment patients opt into under the guise of prevention, the more treatment they step into, because they're being guided by their dental professional as you want to be proactive and not reactive. I'm not seeing that turn out well. I'm finding that to be you start to open a can of worms, and then there's this chain reaction of you're trying to supposedly fix one thing, and then it just creates this cascade of much bigger issues. And there's just very little in dentistry today that I think is beneficial for most people. And a lot of people are being presented with very, very expensive and extensive treatment plans. I myself in my career, I've seen $30,000, $40,000, $90,000 treatment plans. And I think we need to sort of reorganize the way that we think and focus on the preventive side of dentistry. And that comes by way of preventing systemic disease. And that comes with focusing on the quantum principles of sunlight and grounding and these, base core health principles that as humans, we've gotten so far away from, the term rewild, right? We need to rewild ourselves. We need to be much more human than we have been over the past, 20 years of technology and living more indoor lives. It's not serving us.
Right. So how did you come to understand this at the beginning? What was your breakthrough in learning all about this or becoming aware of it?
Very intuitively, honestly. And that's another thing that I think, especially as women, we intuitively know. As a little girl, I always said to everyone, I grew up in a beach community where we would just run the streets and just swim in the ocean all day. You know, we're just so far away from that. And I would always say when I was a little girl, I think I'm solar powered. Yeah, and it was kind of a joke. And now I know.
You knew.
Right. I intuitively knew. And then raising my kids, you know, that is, I think with women, that is the thing that really pushes us toward very much focusing on health and creating a healthy home and creating an environment where we can raise healthy, mentally and physically healthy children. And so, you know, that like becoming a mother, it just really, I thought, okay, I need to be very, very serious about the health of my family and the health within my home. And also, you know, raising my boys intuitively, I always allowed them to run around outside naked. I mean, they spent most of their childhood just running around the backyard naked. And my sister would come over and she would kind of be appalled with that and say, why are your kids always naked? And they were so tan. Oh, they were so tan, and they, you know, such blonde hair and such beautiful, you know, these little tans. And I would joke with her just to shut her up, and I'd say, they're European. Leave them alone. They're European.
That is so cute. My son was the same. Like he was just running around naked till he was like 8 years old, and we lived in
Yes.
Florida at the time, and he was chocolate brown, and we just felt right, and he was a happy kid. It was just normal. But
Right.
now it's like you see what the parents are doing, just putting on all the toxic sunscreen and hats and long shirts, and it's insane, absolutely insane.
Yeah, no, I always made sure that my children got sun exposure. You know, certainly smart sun exposure. I'm not advocating for, you know, let's just start putting everyone outside all day. But you know, taking into account, I mean, my children, we're Portuguese. My husband is 100% Portuguese. So my kids have that beautiful Portuguese skin. So I knew that their systems could handle a good amount of sun exposure without it being damaging. And yeah, I just loved it. I would always get you know, in trouble whenever they went for their appointments with a pediatrician, because they'd be just these little brown babies. And yeah, the pediatrician would say, you need to put sunblock on these babies. Yeah. Don't you worry.
That happened with my son once. We went to the doctor and they pulled his pants down and they're like, he's white.
Yes.
They saw the tan line. He's like, he's white. We were living in Malta at the time, and they thought he was just a little brown boy. It was really funny.
Yes.
Kelly, let's start with fluoride. You mentioned fluoride and how, you know, everyone is used to having the fluoride in our water, in the toothpaste. I mean, obviously you have to brush with fluoride toothpaste, and sometimes they give you fluoride treatments at the dentist office as well. But for someone who is new to this, what is wrong with fluoride? Why do we need to fear it?
It's a neurotoxin, and it's been shown to be a neurotoxin. I mean, I've walked into offices and actually presented the papers showing that they did a study with children, and they showed that it lowered their IQ. And yet the practice just ignored the evidence. And there's been a lot of evidence over many, many years, and that it actually, it's now starting to gain traction, the conversation that we are electric beings. Our body has electric voltage, and that's really important that we maintain that electric voltage. Fluoride interrupts that voltage, and that's a very systemically damaging thing, on top of it being a neurotoxin. I mean, there are so many other things that we can use to potentially prevent a cavity. I'm far less concerned about a child getting a cavity than I am about a child having a lowered IQ and, you know, a lowered redox potential due to using something like fluoride. So, you know, we purposefully chose to live in a community that does not fluoridate their water. There are very few here where I'm at, but that was definitely, you know, something that was on my radar, as far as I did not want to be in a community where the town water supply was fluoridated. So, it's easy to refuse the topical applications of fluoride when you go into a dental practice. More now are being open to allowing parents to make that decision, and they're being more respectful of that decision. I certainly am. When I see patients that, kind of look at me and say, what do you think? But, finding a community with a water supply that isn't fluoridated can sometimes be a challenge, but it is something that is that important that it would be something that, for me, in making a decision as to where we were living, that would have been a game changer in a town, certainly.
That's really good.
It's contributing to, a lot of the thyroid issues, just a lot of issues that we see today as far as, health crises. Fluoridated water is absolutely a contributing factor to most of them, if not all of them.
And does it actually prevent cavities? Does it have any benefits at all? It doesn't.
We just keep throwing it in the water, and we keep pumping it into products and rinses and pastes and treatments and everything you can imagine. And there's been no change in the amount of cavities. It's not preventing anything. There are much better products, certainly focusing on diet. I mean, diet is the best prevention of cavities, certainly. Not allowing kids to snack on things like raisins and sugary things and sugary drinks. That's probably the only space that I would say maybe dentistry is winning a little bit, is that we do get very, very educated on sugar consumption and nutrition. I think in a better way, and in a probably more responsible way than medicine does. So, because we understand that it's the carbohydrate intake. It's the every time you introduce a carbohydrate into your mouth, you're changing that pH balance, and you're potentially demineralizing teeth. So, nutrition is very much part of the conversation in dentistry, as opposed to medicine, where it's typically not even discussed unless, they're talking about McDonald's or something.
Kelly.
So how are you viewed in the dental community?
I like to think I'm adored.
I'm sure you are.
I mean, I have patients that have been with me for 20 years. I have patients that typically I'm booked out about 9 months in advance, because people love the attention that I give to their overall health. When they come into my operatory, first of all, the operatory is set up to support their biology. So I don't have any overhead lighting, none of the bright blue lights. I do have a bright light on me now, but it's a big incandescent heat lamp, because it is so raw and cold and nasty here today, and this room is so dark that I had to put this light on just to actually kind of feel a little bit better. But in my operatory, I have proper lighting. My computer is altered so that I'm not exposed to excessive blue light all day. I have plants in there. I have mitigated and just created this very biologically friendly environment that people feel different when they come to see me, and then they're in person and seeing people. There's an exchange of energy. So if I'm bringing this positive energy into my workspace, because I love what I do and I love interacting with my patients, and I have such long-standing relationships with them. And then, I'm always asking about their health. How much time are they spending outside? Are they mitigating blue light? Many things that I talk about as far as their health, no one else is. Their doctors aren't. And I also get an hour with my patients. So it isn't a rushed appointment. There's a lot of time that I'm going over different things where I am talking about the health benefits of utilizing red light therapy, the health benefits of grounding, of seeing the sunrise every day, of seeing the sunset, of mitigating the blue light. So there, I bring a lot of value into an appointment. far beyond just the dentistry.
Can red light be beneficial for your teeth as well?
Red light is the best tool.
So
It is the best tool.
How would you use it? Can you use it specifically for your teeth?
Yes. Oh, yes. Have you seen my torch?
No.
Yes, on one of your podcast interviews. Yes.
Yeah.
Oh, because
So
I
this
was
is the
listening. That's
torch.
why I was listening to. Oh, okay. So
this is the torch. This can be used anywhere on the body. Everyone uses it. A lot of patients use it on their thyroid. A lot of my patients use it for TMJ because it's battery powered, so you can use it directly. And then I have this little piece that goes onto the top. And then this can be used intraorally. It can also be used intranasally. So using red light intranasally is very beneficial for the brain, for circulation. So I do intranasal red light every day. Intraoral, this is my favorite tool. This torch has saved many, many teeth from extraction. You know, when nerves become inflamed within the mouth, that's usually a signal that, you know, the term that we use is that low redox, right? So meaning like the voltage is low, the energy in that area is very low, and so there's inflammation, there's potential for infection, you know, ongoing periodontal disease. So you need to put energy back into that system so that all those cells, they're sort of superpowered with energy to be able to clean up whatever the problem is. Is it pathogenic bacteria? You know, what is the issue that's happening? And red light is the best tool for that job, because there are no contraindications to someone using this anywhere on their body. And it's so highly effective. I had a woman contact me. I had worked with her in the past, a lovely person, very open to all of this, very educated in all of this. And she contacted me and said, you know, first of all, there was a problem caused to a tooth of hers by them recommending treatment that wasn't needed. So she opted to do the treatment that was recommended, which there's problem number one. In dentistry, not her fault, but by way of dentistry recommending treatment that probably wasn't necessary, which then created a bigger problem. So she ended up contacting me saying, I think I have to have this tooth now removed. And I said to her, hold on. She sent me the x-rays. I reviewed the x-rays. I didn't see any pathology on the x-rays that would indicate the need for removing the tooth. I guided her on how I wanted her to specifically use the torch. I said, cancel the extraction. Let's work on this first. And sure enough, the tooth is still in her mouth. The inflammation reduced. Everything ended up correcting. So red light is my absolute go-to. It's my favorite tool. It's my most effective tool, especially in dentistry. And we've used lasers in dentistry forever. So you know, I'm certified in lasers. It's a very common practice in dentistry. So using red light in the mouth is absolutely just the easiest, and I'm finding it to be the most effective tool that we have.
So are there,
I'm ordering one after the show.
so are there dentists now that are using red light therapy in this way?
Some, you know, some that understand it. Certainly, people that know me, that, you know, have come to know my torch and that use my torch, and that recommend it, you know, for their patients. I have a patient. She is one of the oldest living childhood diabetics in the world. Dr. Jocelyn, who is the founder of the Jocelyn Diabetes Clinic here in Boston, he was her doctor when she was a kid. So, you know, this woman has a very long-standing history of living with diabetes and, you know, a very serious autoimmune condition, as well as multiple autoimmune conditions. And I have seen her. She's been a patient of mine for a very, very long time. She came in. This had been an ongoing issue where her gum tissue, the only way that I could describe it was that it looked like ground beef. It was the tissue was very spongy. It wasn't tight and pale pink and healthy. It was very spongy, lots of bleeding, very, very diseased gum tissue. And after 2 years of her seeing multiple doctors and multiple rinses and prescriptions and everything they could throw at her, I finally said, you need red light. You need red light in your mouth. And she's local to me, so she came over and I showed her the torch and how I wanted her to use it. And she sent me a text within a week and she said, this is the first time in 2 years that I haven't spit a mouthful of blood in the morning.
Wow.
You know, and she still continues to use it, and all of the doctors that she's seeing, they're all very impressed and very happy with what she's been able to accomplish as far as, you know, stopping that inflammation and eliminating that chronic bleeding. And they, you know, they don't really ask what she did. You know, she tells them red light therapy and they just say, keep doing it because it's working. And we just want to keep everything, you know, in this condition. So with her, I'm really proud of what we're able to accomplish with her and helping, you know, improve her health. And she uses the torch on everything. She said to me, you know, her hands are very arthritic. And she said, can I use it on my hands? I said, yeah, of course. So I saw her actually maybe 2 weeks ago, and she came in and she said, oh my gosh, like I can't live without it. I use it on my, you know, my thumb gets locked up with arthritis. I use it on my thumb every day and I now have like full motion. And so she's, you know, she's fully on board. She is sold on red light. And so she's using it everywhere, every day and finding great benefit to it.
Wow, that's absolutely amazing. Mm-hmm. Kelly, what is the difference between the torch and the larger devices that you have behind you?
So the torch, this is a targeted therapy. So the great thing about the torch is because it's battery powered, you can use it directly on the skin so that all of the light that's coming out of the torch is being fully absorbed into the tissue. Yes. So there's no scatter, there's no reflection. All of the light, it's direct energy. It's very focused energy that you can put into the body. The panels are great because the more surface you can cover in red light, the more energy you can absorb. Yeah. So 2 different ways of delivering basically energy. Red light just powers up your cells. It expands that exclusion zone of water. You know, I love when Kelly Bento, my favorite way that she presents the information is that your body is a battery made of water charged by light. And that's exactly what red light is able to do, is it's able to charge the human battery. And it does it with 100% efficiency. So, you know, I mean, there's no way I could live here in the Northeast at this age without utilizing red light therapy. It's been a game changer.
Yeah, I have mine here on my desk. I've been using mine I've had this for quite a few years, but I definitely want to order yours and try that as well. Because I'm like between 2 countries and I'm always moving back and forth, and you know, taking my device across the border is always a pain. So
right
home, I will order from you and get everything. Yeah, that is so cool. I can't wait to try it.
Can you just go over the difference between your red light therapy devices and things like infrared saunas or sauna blankets? Is there a difference, and what would that be?
There is a difference in that the therapies are different therapies. So a sauna therapy is a heat therapy where you're using far infrared to actually heat the body, which is very beneficial. I have a sauna. I love it. I use it all winter. Photobiomodulation, red light therapy is photobiomodulation, meaning you're using photons of energy to modify and change your biology, to elicit a response, to elicit a change within the cell, which is energy. You're basically able to actually put energy into your body in the most efficient way. we tend to believe, and it's partially true, that the food that we eat is what actually produces our energy as humans. That's a little bit true, but that's not the real way of energy for us. Our form of energy as humans is light. It's photons of light coming from natural sunlight. I would never tell anyone that this is by any means any level of a replacement for natural sunlight ever. I always prioritize sunlight first, and then I will add in red light therapy if I feel that I need it. Living here at the 42nd latitude, I definitely need it, especially through, we get many months where we get very little light exposure, where I have access to very little light exposure due to the temperature outside. If I lived in Florida and I was able to be outside much more, then I wouldn't need a therapy like this. So, for me, I this is a good addition, but it's never a replacement for what natural sunlight can do for someone.
Very interesting.
And so it's red light, meaning is it the infrared or?
Yes. So it's wavelength. So all of my products have either 4 or 5 different wavelengths.
Mhm.
Typically, I use 2 in the red spectrum, and then I use another 2 or another 3 in the near infrared spectrum. So what happens when sunlight hits the earth, the visible spectrum of light, everything around you, the grass, the trees, all of the vegetation absorbs the visible spectrum of sunlight, and then it reflects off. It doesn't absorb, it actually reflects all of the near infrared spectrum onto us as humans. So, it just shows you that by design, nature wants us as humans to have all the near infrared. And that's why when you go and you take a walk in nature and there's a lot of trees and there's a lot of green, things that are green, they don't absorb that near infrared. They actually reflect it because nature wants us to have it. The humans are supposed to have it. The humans and the mammals that are running around are supposed to have that light. The plants, they absorb the visible spectrum. So just in understanding that and how nature has designed sunlight to work that way, that then just indicates to us how important and how deficient we are. Because as humans, when we go outside, the light that we're exposed to with all of the reflection of the near infrared on us, it actually makes it that 80 to 90% of the light that our body becomes exposed to is in the near infrared spectrum. So if you were to think that as humans, our biology is still the same, we're supposed to be out there walking around naked, absorbing all of that near infrared all day long. And today, thankfully, we don't have to. We get to live in these comfortable homes and wear cute clothes. So if you were to, think and calculate out what a deficiency that is, and how little light we're exposed to and how much light we actually need, it then shows you that we're all walking around photon deficient.
Absolutely. And that's why we feel so amazing when we're out in nature, in the, excuse me, in the forest, on the beach. It's like a completely different. And inside the toxic homes, we just feel stuck, depressed. The kids, it's a mess. Absolutely.
Yeah. I mean, and that's why when I talk to patients, and where I'm explaining the use of something like this, and I always will bring them back to think about how you feel when you spend a day outside, when you spend a day at the beach. You feel fantastic. Mm-hmm. That's photons. That's the power of photons. That's the beauty of them. That's the gift of photonic energy. And like I keep saying, your body understands that information and it knows exactly what to do with it. Exactly. With 100% efficiency. So, unlike food where you have to source the right food. You have to make sure that it's clean, healthy food. And then you eat the food and you have to digest the food, and you hope that you can digest it properly, and you hope that you can assimilate and absorb. And there's a whole lot of things that have to go right in order for you to get that energy from that food. And even with the food, most of the information and most of the energy coming from food is also light information. It's also, energy of light information that's imprinted into food. So even food is about light.
Kelly, what about, like, for example, if somebody needs a root canal, could red light therapy also help prevent something like that? And what's your take on root canals?
There's a lot of talk in the biological dental space that root canals cause breast cancer. I think that's a ridiculous statement. I think that a low redox, systemically poor health, systemically low, electrical potential is what caused the cancer. It's also what caused, a root canal is a symptom of a bigger systemic issue. So, a tooth dying, it's always a symptom of a bigger issue. So the treatment for the dying tooth, they then assign, well, women that have root canals end up with breast cancer. Well, the women that need root canals have something happening. There's a systemic issue that caused that root canal. Whether, usually, honestly, I will say low vitamin D across the board. When I see children with a mouthful of cavities, yes, there's a nutritional component to that without question. But oftentimes these are very pale kids. These are kids that have low vitamin D. It's atrocious to think that there are children running around with low vitamin D. That's a terrible signal in where we are in society today. But this, perpetuated fear of the sun, and everyone just slathering themselves in sunscreen to potentially prevent skin cancer is driving a much bigger health crisis. And so, if I see someone that presents with root canals, and then I do see a correlation between root canals and women who are diagnosed with breast cancer, but I'm not blaming the root canal for the breast cancer. I think that's a very reductionistic way and a very narrow-minded, nearly ridiculous statement to make.
Can the root canal itself cause any health issues? Because
people ask me
like
this,
leaving a dead organ inside your body,
right.
Fighting against
people ask me this all the time, and I don't feel comfortable telling people to run out and have all root canals removed. My focus is let's improve your redox potential. Let's get you into sunlight. Because the thing is, if you have an existing root canal in your mouth, I don't think rushing and having it extracted out of fear is going to serve you. I don't find that to be a health move. I think let's get your vitamin D up. Let's get your overall health improved. Let's have you practicing all of the important principles of sunlight, of grounding, of eating good, healthy food, of drinking really good water, and eliminating the toxins and getting that lymphatic flow to work properly. Root canals become nearly a non-issue. I have yet to find someone that had a root canal tooth taken out and then all of their health concerns corrected.
That's so good to hear, because there's a lot of fear mongering going on around root canal. And I have one, and the only reason I got a root canal was very young, because I had health insurance. So the dentist wanted to make more money. So instead of just doing a filling, which would have been, I don't know, $100 back then, it was $500 for a root canal. So it really upset me once I found out how dangerous they can be. And it's always on my mind. And I think the fear that's driving it is not. So you really put my mind at ease regarding that. And I'm really happy to hear that, because I think my lifestyle and the way with using the quantum biology principles and everything, that should negate any ill effects of having one root canal in my mouth, correct?
Right. Right. I myself, I have 2 root canal teeth.
Okay.
And it was due to trauma. When I was a kid, I was hit in the mouth and, teeth were broken. And so it was trauma. It certainly wasn't a systemic issue. It was a traumatic issue.
Yeah.
And so I have 2 root canal teeth in my mouth. I have them checked. I do get, every couple of years, I do get a cone beam, which is a very detailed X-ray in order to check them and make sure that there are no underlying infections that I may not know about. And I've had that done, and that's always clear. And I believe that that's attributed to, living a good, healthy lifestyle, right?
Ultimately,
And
that trumps everything.
right, yeah,
Right?
it does. It without question. It's like let's focus on the macro and not the micro, right? Like I don't feel good about driving this fear narrative and getting people to go and have teeth removed out of fear that maybe someday. Let's focus on the positive things that you can fully control.
Yeah.
Which is the way that you live your life and the way that you move about your day.
And what about wisdom teeth? Teeth extraction.
Yeah, I don't support that unless it's fully necessary. So, the whole wisdom teeth conversation, that starts at birth, right? So let's get mothers nursing their babies, and let's get babies actually eating foods that stimulate proper jaw growth. And that means chewing foods. Again, that fear narrative. Don't feed your baby foods that they could potentially choke on. Babies have been eating foods, this has been since the beginning of time, right? We didn't have Gerber baby food 100 years ago. And how did babies manage to survive? Everything does not need to be blended. Babies need things that they can chomp on to allow for proper jaw growth. My kids, when they were babies, they chawed on a rib bone, like a spare rib bone. They would just, we would give them the bone and they would just gnaw on it. In my opinion, that was probably the best teething ring. It wasn't plastic. It was a nice, juicy, meaty, flavorful rib bone.
Or beef,
so I think,
beef jerky, those kinds of things are really good.
Yeah, I think eliminating that fear that your baby is going to choke to death, and let's start getting babies, doing that action of mouthing food, chewing food, mastication. That also stimulates good digestion, and that potentiates proper jaw growth. And we don't see that. Most kids are moved into braces today because of that, because it's nearly every single kid is sent into braces because they weren't fed solid food until they were a year or 2. No, at 6 months you need to start feeding babies foods that they can chew on. So that's where the whole wisdom tooth conversation, that's where it starts. Let's start there. But if you do get to a point, and again, with wisdom teeth, that is also a false narrative that all wisdom teeth need to be removed. No, they don't. Both my boys, my husband has his wisdom teeth and perfect occlusion and never needed braces. Both my kids have their wisdom teeth. And even the doctor that I work for is like, well, you might want to see the oral surgeon and maybe have them extracted. And my question is why? They don't bother them. They're coming in straight. They're there for a reason. There is a lot of information and a lot that indicates that removing wisdom teeth in these kids is a very bad idea. Oftentimes it can lead to, pushing someone's system into an autoimmune condition. I don't think that's ever a good idea. I think you only go toward a treatment like that if it's highly, highly indicated.
Yeah, and I mean it's also good money, right?
Oh my gosh. Yes.
Like surgery, in-office surgery, they're impacted, they're going to cause you all kinds of issues, lots of fear mongering going on there. And I'm sure a lot of them are being removed without them being necessary at all.
Oh yeah. Well, now what they're doing is they're actually telling 14 and 16-year-olds, when we're seeing the little wisdom tooth buds
Yeah.
in the jawbone, they're sending them automatically to the oral surgeon. So they're not even giving these teeth a chance to erupt and to see, if can the jaw handle them.
Yeah.
They're not even it's just the conversation is all wisdom teeth should be removed and all kids are referred out to the oral surgeon. Not my kids.
And it's quite normal, I heard, that they start growing in sideways originally, and then they kind of turn. But they show you that X-ray that look, it's gonna make all your teeth crooked. There's no space. It's growing sideways, right? And
Mhm.
panic, and you think, oh my God, I have to have these out.
Right. Yeah, I don't support that at all.
And what about implants?
Ah,
I have to tell you, my husband, he got 6, 7 implants. And since
Yeah.
then, we have about 50 new channels on our TV. So I'm not sure if they're connected. Is there a correlation? Tell me.
I mean, again, we're talking about a 10, $11 billion a year industry, right?
Wow.
Yeah. I mean, I don't really support them. I think that years ago, when teeth were lost due to whether it was through disease or through trauma, they would fix the problem by creating a bridge. And the bridges were, very, very successful in restoring function and also restoring aesthetics to people that had to lose teeth for whatever reason. Nowadays, the conversation is immediately to, well, have that tooth taken out and then you should replace it with an implant. And there's a lot of evidence that shows that the failure rate and the health implications of things like breast implants and tooth implants, a lot of that information is being very suppressed because it is both of them are just very money-driven industries. So, that alone tells you something that, and I see it all the time. I see implants fail all the time. And a single tooth implant is anywhere from, depending on where you are in the world, can be anywhere from $5,000 to $10,000. And I've seen implants placed in a month later, they fall out. So that was a very expensive procedure to have. And typically, it's almost like the blame is placed on the patient that they must have done something wrong. Maybe they weren't cleaning it correctly. And so there's also a little bit of shame involved in it as well when an implant fails. Well, typically implants fail because they were placed in an area that, again, the underlying reason wasn't addressed. So if someone loses a tooth to disease, there's a reason for that happening. And nothing is being addressed in that space. It's, oh, okay, so your natural tooth is dead and dying and we need to take it out. So now we're going to put this fake thing in here and that's going to be fine? No. So I see implants fail all the time because the underlying health issue was not corrected prior to the placement of an implant. Now, that being said, I'm okay with doing a zirconium implant, which is more of a ceramic, although it does contain transition metals, which a lot of biological dentists will say, oh, there's no metal in this. This is much safer. They are shown, the evidence is there. They do contain transition metals, but certainly they are a safer alternative to a full titanium implant. I do support someone getting implants. My husband does have an implant, and it is a titanium implant. But again, focus on the important things. Keep your redox potential up. Live your life in a healthy manner, and your system is able to support having an implant. We are not that fragile. We are not that fragile that a root canal or an implant or a cavity is going to take us out. We're not that fragile.
Can you just go over some of the common effects, negative effects of the implants? What do people run into when they have them put in?
I mean, they depending on the placement. I mean, first of all, there are a lot of dentists that think that they can place implants and they really shouldn't. It takes a very skilled surgeon, someone that has a full understanding of hard and soft tissue to place a good implant to have a good outcome. And honestly, again, it takes a patient really focusing on their health to support a system to be able to handle the implant. So, you know, there's a lot happening there. You have a lot of dentists that think that they can just put an implant anywhere they want, and they're really not skilled enough to do that correctly. So the placement of it has to be perfect. The bone has to be in really good shape. The overall system has to be in really good shape to be able to receive the placement of the implant, and then the care of that implant and the ongoing focus on keeping health, keeping your health level high. All of that is important. I mean, the things that I see are typically, usually the driving factor is low vitamin D. If you can keep your vitamin D up, you can very much avoid almost anything. All cancers are tied to vitamin D. Pretty much the health of the entire system is very reliant on vitamin D, which is a metric of how much sun you were exposed to. And, I'm not saying like be out there all day, but, certainly be mindful and get responsible, a good amount of sun exposure, even just being outside. You don't necessarily have to be in the direct sunlight, but even just being out there is going to support your health.
Without sunglasses and without sunscreen, right? That's important.
Yeah, definitely without anything covering your eyes. Yeah.
Do you see any concern at all with with Wi-Fi and all the radiation around us? Like, could that be an issue with the implants?
Yes. Yeah. I certainly wouldn't, if there's someone that's addicted to technology that's walking around with AirPods or a phone to their head or, Bluetooth earbuds in, I think that's a very, very bad idea to have titanium implants in the mouth. It's an antenna.
Yeah.
It's drawing signal into your skull. That is not a place that metals should be when you're using things that are drawing a Wi-Fi signal toward you. And that, I mean, a big problem with orthodontics is we fill these kids who, first of all, they had improper jaw development. And then our answer to that is, we're just going to go in there and we're just going to pave the entire mouth with metal, and then these kids pop AirPods in their ears 12 hours a day. It's a very bad idea.
Yeah, people don't even think of these things. Like they
Right.
don't even give it a second thought. It's just
Mhm.
technology over anything else. Kelly,
Right.
what can you recommend to someone? So we talked about diet, how important it is. We talked about vitamin D, how important it is. Red light therapy can be very beneficial for your teeth. Other than that, is there do you believe in oil pulling, for example, or what other things can we do for our oral health and to maintain our teeth for as long as possible?
Maintaining good mineral balance is very important for teeth. So,
is there something
what I do
for that, or good mineral water?
Yeah, certainly, drinking really good natural spring water, but remineralizing it with something like a sea salt is a good idea. What I do is when I wake up in the morning, so a lot of people, here's one mistake that they make in their oral health is a lot of people wake up, they immediately go into the bathroom and they brush their teeth. Well, the oral microbiome is designed to propagate the gut microbiome. So I tell my patients, what I do is I wake up, I come downstairs, and I have the Quinton, the bottle of the Quinton minerals, raw sea minerals in my fridge, and I take that out. I'll take a swig of that and I swish that around for, I don't know, however long, 30 seconds to a minute while I'm, just doing whatever in the morning. I'll swish that around 30 seconds to a minute, and then I swallow it. So I'm sort of remineralizing any demineralization that may have taken place throughout the night. And then I'm also swallowing, so that I'm then propagating the oral microbiome. I'm then propagating the gut microbiome. So, instead of just going in there with some kind of, toothpaste and rinses that they just kill everything. They kill all the good, they kill all the bad, they just kill everything. It's not a good idea for good systemic health, oral or gut microbiome health. So that's what I do as far as a remineralization. And then I just make sure that I maintain proper mineral status. And again, that goes back to that redox potential, right? Like you have to have good mineral balance within the system in order to maintain tooth health, bone health, and general health.
So no mouthwash.
No, no. I mean, some of my patients, I always say, don't use anything. Don't use any kind of an antimicrobial mouth rinse, nothing like that. Some people like a natural mouth rinse. I'm okay with that as long as it's something natural that doesn't contain fluoride or antimicrobials. I'm okay with that. If you feel like you need that as a bit of a refresh or something, that's okay. Beyond that, I mean, all of these antimicrobials have actually, a lot of the nitric oxide comes from the oral microbiome. So using this excessive use of these antimicrobials in the mouth are certainly being talked about as being a factor in people's elevated blood pressure, because
Yeah, that's
yeah.
What an interesting connection, right? That's something.
Yeah, it's for every action there's a reaction. So you just have to pay attention to what actions do you want to cause, and what is the reaction that you're hoping for.
And for your toothpaste, what kind of toothpaste do you use, or what would you recommend?
Sometimes I just brush my teeth with just warm water. This again, like this thought that, we are so fragile that we need all of these medicaments to save us. I don't subscribe to that. The body knows exactly what to do as long as it's getting the right input of information. So if I do use a toothpaste, which I mean, sometimes I do, most of the time I do, but I use very, very little of it, just the tiniest little bit. And I use a paste that typically, a very natural toothpaste that does not contain fluoride, that contains hydroxyapatite, which is a mineral that actually helps build the tooth back up. So if you have a small spot in a tooth that may have become demineralized, which is considered a cavity, the start of a cavity, that will heal. This sort of rush and jump to fill teeth is again a very bad idea that dentistry propagates. The teeth will heal themselves. You just have to give them the proper information, and minerals do that. And the Quinton minerals are good because they can be absorbed, and using something like hydroxyapatite directly on the teeth is also a really good idea at helping to remineralize. The one mistake that I will say that people make when using pastes like that is they use them like they use a regular toothpaste. They do need to be used a little bit differently, that people don't quite understand. And I always educate my patients on this. You brush with those pastes and you spit them out. You do not rinse them. And then you have nothing to eat or drink for 30 minutes after you've done that. And that is going to help. Then the teeth will be able to uptake of those minerals. If you drink something or you rinse it out, you've just lost it. You've just rinsed off the minerals that you're trying to get deposited into the teeth.
That's very
And
interesting.
is it true? I've heard that you can make your own hydroxyapatite by crushing eggshells into a powdered form. Is that correct?
That sounds like a lot of work.
It is, yes.
I think it's a whole lot easier to buy a good, healthy toothpaste that has that already done. I think I personally I wouldn't do that, simply because the abrasive, you would not be able to grind that shell fine enough that it wouldn't be abrasive. And you don't want to use anything that is abrasive. So if I had a patient come to me and say that they were doing that, I would recommend not doing that. I mean, I get the idea behind it, you know, but I don't think that that would be a net positive. I think that would probably be a net negative, because it's too abrasive.
And what about flossing? I've seen a lot of controversy around it lately. There's a doctor, what is she? Ellie Phillips or something like that. She's saying that flossing is actually horrible for you.
Yeah, it is.
Oh, okay.
How so?
Let's talk about that a little bit more.
So most of the flosses on the market today are horrific. They're coated in these microplastics. And within the mouth is one of the only places in the body where things that you put in your mouth, they have a direct line into your bloodstream. That's why a lot of medications and things, you know, are given under the tongue, sublingual, because you're able to get things into the body very easily by way of the mouth. And so, you know, this chronic introduction of these microplastics into a very vulnerable area, you're actually going, you know, beneath the gums and depositing microplastics that can very, very easily make their way into your bloodstream. I don't support that whatsoever. I don't think that that you're doing any good whatsoever. I mean, here's what I'm going to tell you. I have unlimited access to all of the dental treatment that I want every minute of every day. I could, you know, at a world-class biological dentist, and also at a conventional dentist. I choose not. I don't get my teeth cleaned very often, because I will tell you, I don't need it. And that shocks people. Yeah. And I say, I probably get my teeth cleaned. I mean, I certainly used to go every 3 months, every 6 months. And then 10 years ago, when I started really focusing on the important things, sunlight, grounding, time outside, positive relationships, good healthy food, I found that I don't build up plaque or calculus. I don't need dentistry. I mean, the goal is to get the system to a point that you don't need a doctor and you don't need a dentist. And so I don't opt into dental treatments. I typically don't need dental treatments. My gums are fine. My gums don't bleed. If you're brushing your teeth and your gums bleed, you do need to see a dentist, and you do need to pay attention, and you do need to focus on your health. But again, living a healthy lifestyle eliminates the need for needing any of the interventions.
So no tooth whitening either.
I mean, I'm not opposed to tooth whitening. I think that's pretty benign. That's not one of the things that I would be very staunch against. I'm okay with people that want to whiten their teeth. I don't. The active ingredient is typically a peroxide based, which it's not typically very harmful to the system. So I'm not, if it's going to make someone feel better about their teeth cosmetically, I'm okay with that. In the world of aesthetics and all of the really harmful things that are out there, yeah, whitening your teeth is probably the least offensive thing and delivers the highest return. I think having a bright smile definitely is a great sort of boost, so.
Definitely.
Yeah. That's the one I will say. I'm not opposed to people doing that. I'm okay with people doing that. If I see someone, if you have very discolored teeth, again, that's something you need to address. That's typically a deeper issue. That's something someone needs to look deeper into. But throughout your lifetime, your teeth are going to discolor. That's simply just the nature of it. The outer layer, enamel, is translucent. Teeth get their color from the inner structure, which is dentin. So, being able to use something like a peroxide-based tooth whitener to sort of oxygenate and lift a little bit of the staining from the internal structure of the tooth, I'm okay with that. That's the one thing I'll give you. Yes.
Sounds great, Kelly. Can you please tell our listeners where they can find you, how they can learn more about your red light therapies, where they can find you?
So I'm pretty active on Instagram, as much as I don't want to be on technology. You're often driven to technology. So I'm on Instagram at the Quantum Mom. And my red light company is Soleil Well. It's fine. Everyone kind of says Soleil Well, and I'm like, no, it's Soleil. It's such a beautiful word.
Beautiful word. And I will make sure to link everything below so they can easily find you. Kelly, thank you so much. We learned so much about teeth and oral health, and I think this is so important to spread the news, because people are just lost and they're just blindly following conventional dental care, and there's so much more to it than that. But ultimately, I think the takeaway message is that when your health is number one, right? So if you're taking care of your health, your redox, your environment, everything else, your teeth are just part of that whole plan. And I think a healthy body, healthy mind will have healthy teeth.
Exactly right. Yes, focus on the important things and your teeth will be fine.
Wonderful, Kelly. Thank you so much for being here.
Thank you, Kelly. It's been so amazing. Great. Thank you.
Thank you, everyone.
Thank you
See
both.
you in the next one.
Thank you for tuning into the Rewilded Human podcast. We hope you're leaving with insights to reconnect with your natural, vibrant self. Remember, the information shared here is for educational and inspirational purposes only, and is not a substitute for medical advice. Always consult a qualified healthcare provider for any personal health concerns. If you enjoyed today's episode, please like, subscribe, and share it with others who might benefit. We'll see you next time, ready to dive even deeper. Stay wild, stay true, and stay tuned.